So one of the labs that rheumatologists often check to look for inflammation is called an ESR, or erythrocyte sedimentation rate. And it basically measures how fast a red blood cell kind of falls to the bottom of a test tube. And the faster it falls, the higher the number, the more inflammation is likely present. Now, it can be affected by age, anemia, even other infections, so it's definitely not a specific marker. Another marker of inflammation is called the CRP, or the C-reactive protein, and it is a protein that's made by our liver when they're in response to inflammation, basically, and it usually rises and falls faster than the ESR does, so it's a little bit more of a real-time marker of inflammation. Another lab is called the CBC, or the complete blood cell count. And this doesn't tell us about inflammation by itself, but looking at things like the white blood cell count, your hemoglobin, and your platelet count, sometimes we can gather whether or not there is inflammation present. For example, if your white blood cell count is high, your hemoglobin is low, or platelets are high, this kind of points towards inflammation happening in the body. And the last marker that's often checked is called the ferritin. Normally, ferritin is a marker of overall iron storage in the body, but it can spike when you have inflammation, and it's quite useful in patients who have systemic onset JIA. So those are kind of a few of the markers that rheumatologists get. A lot of times it's used to trend inflammation with treatment to make sure all these are normalizing. Remember, it's not always just the numbers that we're looking at, it's also looking at the history and the exam.